Welcome to traumaticbraininjury.com. Traumaticbraininjury.com is the leading resource on the internet for resources regarding traumatic brain injury for survivors, families, and caretakers. My name is Stewart Cohen. Today's guest is Dr. David Lenrow. Dr. Lenrow is a physician who specializes in physical medicine and rehabilitation. He's on staff at the Hospital University of Pennsylvania since 1987, and he's also on the faculty at University of Pennsylvania Medical School. Dr. Lenrow is involved in treating patients with traumatic brain injury as a regular part of his practice. Dr. Lenrow, thank you for agreeing to appear on traumaticbraininjury.com.
Thank you for having me.
Just a couple questions about the effects of a brain injury. I know that you've told us that there are differences between the kinds of brain injuries, that there are mild, moderate, and severe. Could you just explain to us what they are and how you doctors use those diagnoses?
Those categories of brain injury actually vary depending on what scale you're using to make those the diagnosis of those different categories. But in general, a mild traumatic brain injury is someone who's had a loss of consciousness for less than 30 minutes and who has symptoms that are generally restricted to how they think. So dizziness, trouble with frustration, concentration, those sort of things. A moderate brain injury is someone with a more significant injury to the brain where it may affect their ability to use certain parts of their body. They may not be safe to be left alone and generally need help with doing normal activities of life. And a severe brain injury, or the worst category, is someone who's essentially in a coma and doesn't interact at all with the environment.
Can someone who has a mild brain injury have serious disabilities with regard to work?
Yes, and not only with regard to work, but with regard to interaction with friends, family, and normal activities of life. So calling it a mild injury is somewhat of a misnomer, or somewhat unfair, I would say, because the functions that could be lost can really be devastating to a person's life. So they may easily get frustrated. They may have a poor attention span. They may have ringing in their ears or nausea or constant headache. Activities which may be affected include simple things like even keeping the checkbook, functioning at work, getting along with their spouse, things which can really be devastating in the long run.
Well, let me just tick off a couple areas and ask you questions about them. Does a brain injury affect the way someone thinks?
Yes.
In what way?
Again, it depends what's affected in the particular person's injury, but it can affect their ability to do calculations. It commonly affects memory. It commonly affects concentration and attention. So it would be harder for some people to sit and have a conversation without becoming distracted by something in the environment.
All right.
And those would be common things to see.
Now, you mentioned before something about behavior, that a brain injury can affect behavior.
Yes.
How does a family member, and I assume that some family members of brain injury survivors are listening to you today as you speak, how does a family member determine whether a problem is behavioral or as a result of the brain injury?
Well, I think certainly education for the family is very important at that stage, because otherwise the assumption might be that their loved one who has the injury is just acting out or has a psychological or behavioral problem.
Is it psychological or behavioral? Excuse me for interrupting. If
Well,
there's a real brain injury.
If there's a real brain injury, it's organic, and if part of the brain is damaged that, for instance, regulates impulse control, the person may act entirely differently than they did before. They may be sexually aggressive. They may be agitated all the time. Some people don't remember anything that occurs after the injury, and that's called post-traumatic amnesia. And those patients will act very strangely to their family, and they'll complain that they never visit them. They essentially remember nothing that happens for more than a few minutes to up to hours, and it's like living life new every day for these patients, and it's very frustrating for family. But it's certainly not behavioral, it's an organic problem.
What advice do you have for family members of survivors when dealing with these kind of behavioral effects? I know you talked about education, but as a practical matter, what do you mean? What should they do?
They should be as supportive as they can be, and that is very difficult for people. But the more they understand about this, the easier it is. And the more supportive they are and the more they reorient their loved one who's injured, the more likelihood that they won't get as frustrated. And with time, hopefully that will improve, and it often does. And early on in the injury, many patients have these difficulties, particularly if it's a moderate to severe brain injury, and it often improves with time.
We have resources listed on traumaticbraininjury.com across the country, state groups like state brain injury organizations and national brain injury organizations. Do you encourage family members to reach out to those groups? Absolutely.
I think any support group and educational venue that families and patients can access are certainly worth their time. And so is a local physician who specializes in brain injury and the therapist that's likely to treat their loved one. All those are great resources for patients and families.
Thank you, Doctor.
Thank you.